And we are following some breaking details on the GOP's effort to repeal and replace Obamacare. We're now learning that House Republicans will huddle Thursday morning to talk about a path forward on a new plan. Just this morning, the leader of the conservative House Freedom Caucus, Congressman Mark Meadows, who was against the original plan put forth by his party, suggested that the GOP now has enough support to be able to pass a new plan.
I think we're just a handful away.
And do you want the White House more involved or less involved with the negotiations?
You know, obviously this is something that the leadership here in Congress has to address, and so it's really in their court.
CBS News chief congressional correspondent Nancy Cordes joins me now from Capitol Hill. Nancy, so is Congressman Meadows right about this? Are they just a handful of votes away?
They may be just a handful of votes away, but that's still a handful too many, because according to our current whip count, there are about 21 House Republicans who are firm no's, and they can only afford to lose 22. That's before you factor in all the Republicans who are on the fence and haven't said which way they're going to go. Just today, Fred Upton, an influential member of the House, longtime Republican, chair of the House Energy and Commerce Committee, announced on a local radio station that he is voting no. He's too concerned about the latest version of the bill and what it means for people with pre-existing conditions. When you've got a top member of the establishment like Upton saying he's not comfortable, that is bound to have an impact on other members who are on the fence. So no, as of this point, they're not confident that they have the votes. If they were confident, Rena, you would see them calling for a vote today.
That's a very telling sign to hear you say that. But what's the major stumbling block right now at this point?
Well, right now, the big challenge is this amendment that was added to the health care bill to try to win over members of the conservative Freedom Caucus. This amendment was designed to address their concerns that the bill left too many of Obamacare's patient protections in place, outlining minimum coverage levels for individuals. They thought that all of these rules and restrictions drove up the cost of health care, drove up the cost of premiums, and they said, hey, if you get rid of some of these restrictions, maybe care will be less costly for a lot of people. However, if you get rid of those restrictions and you tell insurance companies that they can, for example, charge people with pre-existing conditions more, those people could find themselves priced out of the market. Now, the authors of this amendment say they've come up with a way to deal with that. They would give federal money to states that waive some of these restrictions so that those states could then help pay for people with pre-existing conditions who find themselves suddenly hit with much higher premiums. But these Republican members who are on the fence or voting no are simply concerned about how that's going to work. They worry that that is a system that has had mixed results when it's been implemented by states in the past. So the way Republican leadership put it to us today is that they're in the midst of a member education system where they're trying to explain to their own Republican members why this approach will work, why it will be better for people with pre-existing conditions. But as you can see, some of those members have gotten the education and just aren't willing to get on board yet.
Okay, and we know this morning the president tweeted two things that got a lot of attention on Capitol Hill. He said that it's time to change the Senate rules, and he also said that it's time for a good shutdown to get spending in line. What was the reaction, Nancy, on Capitol Hill to this?
Universally negative. Republicans, some of them said that they appreciate how frank the president can be, but frankly, it's not great when the leader of your party is openly advocating a shutdown, because Republicans are trying to show that they are good stewards of the government. They control both the House and the Senate, and if their own party looks like it's advocating for a shutdown, which we've seen have some pretty dramatic effects in the past. The government lost billions of dollars the last time we saw a shutdown. It isn't a great thing for the party. The reason he sent those tweets is because he's been getting some blowback from conservative groups about the latest spending deal. Groups asking, why didn't you get everything you want if your party controls Congress? Why are we still funding Planned Parenthood? Why didn't you get the money for the border wall? And so this was the president's way of saying, well, it's not my fault. It's the problem with the Senate rules. Let's change the Senate rules. Maybe we need a good shutdown to sort all this out. But Republicans and Democrats alike in the Senate said they're not interested in changing the rules. It's important to have the kind of rules that they have in the Senate. It requires the two parties together, and they're not interested in a shutdown either.
Never a dull moment for you, Nancy Cortez, on that Capitol Hill there. Thank you for joining us, Nancy.